Our next thread is titled Frenectomy, Horrible Mother. We had an upper lip tie and tongue tie surgically addressed for our baby this week, and I can't shake the feeling of regret and feeling like it was the wrong choice. The consult felt like just being pushed into the procedure, and I feel like I've seen no marked improvements since then. Although I was told he may have ties a couple of weeks ago and did a ton of research on the procedure and everything, I felt relatively knowledgeable about the symptoms and treatments. When we got to the appointment, the dentist gave me a check sheet a checklist, I guess, to fill out with varying statements. Does baby have trouble latching or staying latched? Are your nipples misshaped or blanched during feeding? Does baby fuss at breast or bottle? Does baby chew or gum your nipple? Does he seem hungry all the time? Does he have colic or is he irritable? These are just a few examples I remember, but I nearly checked off the entire sheet in terms of the problems baby and myself were having. Anyone else? I'm just mad at myself for not taking more time to think it through and caving to the dentist's pressure to have it done. My husband and I discussed whether to do the procedure before we signed paperwork, but it still felt rushed. I also feel like a horrible mother for putting my child through such a procedure. I spoke with another mum whose child is a bit older than mine, and she said the dentist recommended not to do the frenectomy, but to try body work instead. We didn't see the same dentist. Am I a crappy mum for putting my child through such an ordeal? Now, this is one that is quite complicated on a number of levels. I'm going to start by saying a frenectomy is a procedure that's quite common nowadays, unfortunately, in babies, where if you say there is a little piece of flesh that attaches your lip to your gums on the top and on the bottom, there's also a little piece of flesh that attaches your tongue to the bottom of your tongue there. I'm pretty sure everyone knows what I mean. That is sometimes referred to as a tongue tie or a lip tie. Or a cheek tie. You have them on the sides here as well. And sometimes nowadays, when babies have problems with latching, one of the potential causes of those issues might be that their tongue ties are a little bit too short, so their lip ties or their cheek ties or whatever it is, so that they don't have quite the same level of mobility that you would want them to have in their oral cavity that they need to have in order to be able to nurse properly. This is one potential symptom or way of seeing that there might be a problem with regards to that. The other way in which that manifests itself are speech impediments when kids are a little bit older, and then they have a hard time saying things the way that they should be able and pronouncing things the way that they should be able to say them, just because they don't have the same level of mobility in their oral cavity. So that's what this is. A lot of people have them those surgically snipped, and that will mean that that piece of flesh is not holding anything there anymore, so that kids can relearn how to use their mouths. Now, I think it's a completely separate question. The way that I read this thread would be to say that there's a very different question here, whether this is the correct procedure for your child or not. That is one aspect of it. And that is something that only every mother and child and doctor can decide on the basis of that particular individual child. That is not something, I say mother, also parents, not just the mother. But this is something individual, and you can only do that on the basis of a consultation with an expert who really knows what they're talking about and having a proper in-depth conversation. What I think is very clear from this thread is the way in which the medical establishment interacts with parents and interacts with people in general, patients. And that is where I would argue the biggest source of regret for this mum is coming from. So when she says, hey, I'm mad at myself for not taking more time to think it through and caving to the dentist's pressure to have it done. So what that says to me is that she ultimately does not feel like she had a proper consultation. They did not, as a couple, they didn't actually sit down with the dentist and have a full, comprehensive, detailed explanation of what the procedure meant for their child, why it was necessary to do, what the risks of not having it done would have been, what alternatives they may have had as parents if they didn't want to get it done. It sounds to me like that whole conversation was just lacking. And the experience that she had from her interaction with the doctor was that he gave her a piece of paper. He said, yeah, just look through it. And when she said, yeah, okay, I do experience quite a lot of these symptoms, then he just went, cool, great, then we should get it done. And there was pressure there. And it wasn't a considered decision. And this is one of those circumstances that I think as a parent, you have the opportunity to either make a really great decision, or make at least what you can confidently stand behind and say, that was the best possible decision that I could have made at that time, because I really invested all the time that I could in getting all the information that was necessary and getting the advice that was necessary to make the best decision for my child. So there's that way that you could walk out of this type of consultation, have that feeling. The other way is what she has, where you go, hey, you know what, I'm not actually sure that went all that great, and maybe this was a mistake. Now, it's possible that you still make a mistake for your child. The decision ultimately does not help at all with any of the symptoms that they're experiencing, that it was not the correct decision for them, but you still invested all of the time in making the best possible decision. As far as I can tell, she did not invest that time, and that's why she feels that sense of regret. And that, I think, is a really major problem in medicine today, because this is not just the case for parents who make decisions for their kids, but it's also the case for mothers during the whole pregnancy, labor, birth experience. It is also the case for anyone who experiences any kind of illness. It is very possible that you end up with one of those doctors who, again, assuming good faith, let's say they are totally dedicated to making you as healthy as possible. They just want to help you. But also, they've been doing this job for 20, 30 years. It's kind of repetitive. They see the same types of cases over and over and over again. They've lost the ability to engage with you as an individual and to treat you as a unique person. And this happens all the time in the medical establishment. Like, this is just a pretty common way that people have of just dealing with that. You know, it becomes routine. Whenever something becomes routine, then you stop engaging on the same level as you did when it was new and fresh. And so, as anyone making any type of medical decision, Robin Thompson of the Thompson method will always say, you should always ask, what are the benefits of this procedure? What are the risks of having it done? And what are the alternatives that are available? And if you know those three things, then you can, at the very least, make an informed decision and stand behind it. And this is 50 million times as important when you're making decisions for your kids, or when you're making decisions for any other dependent who cannot decide for themselves, because then you can really do damage to someone else by accident, without intending it, despite having the best of intentions. And I think that that's a regret that's really hard to get over. So that's what I would say to OP here. I think that essentially the lesson that she needs to take from this, or the lesson that I would take from this experience, is that I will never allow myself to be pressured to make any kind of medical decision for my child in future. And if I'm talking to a doctor who I think is treating me like that, then I will not be taking any of their advice seriously. I will go find a different doctor and get another opinion and try to inform myself a lot better before I go along with it. And then the hope is that at the end of it, even if I make a mistake, I can genuinely believe that I did my best as a mother to make the best decision for my child. A lot of people respond very differently to this, because they take the frenectomy as the medical decision in and of itself. And then they go, hey, no, this was a great decision. I had it done for my child and it really, really helped us. So probably it was the best decision for you as well. Here's an example. For me, that checklist was the most reassurance that I was doing the right thing. I was also a little hesitant. Baby was gaining weight. We were exclusively breastfed. She was just a bit fussy. It was missed by multiple people, so was it really that bad? Then as the dentist went through each symptom and I said yes to all of them, I realized that it maybe doesn't have to be this difficult. We are 1 week out and haven't seen drastic improvement, but a few feeds have been significantly better. I still get really frustrated. It seems like nothing has changed, but I'm trying to be patient. All that to say, you are not a bad mom. This is a difficult road dealing with ties, and it sounds like you did a lot of research. I hope now that it's been a little longer, you're feeling more confident in your decision. And so to that, I think that this association of, okay, if I make this decision, am I a bad mom? Then this is not a constructive or not a helpful way of looking at the situation. Maybe you made a mistake. And maybe if you learn from that mistake, you can be a better mom in future, but it doesn't necessarily mean that you are a bad mom. As you can see, though, sometimes people are really like on the fence, where they go, I'm not sure. I guess we'll see how it goes. This comment is the opposite. This person says, when my last baby was a few weeks old, I went to a lactation consultant. She told me to try clipping for a tie. I told her that we'll wait and see what a few more weeks looked like before resulting to that. Feeding significantly improved in the coming days. Baby was still learning and so was I. 4 years later, I realized we never needed it. I think there are babies that truly might need it, but I also feel like this solution is just thrown out there as an easy response. I hate to say that, but it's true. Regardless, it's already done, and I'm sure everything will be all right. Just keep moving forward. And so that's a perfect example of why, as a parent, you should really inform yourself. You should really understand what the negatives, what the potential negative consequences might be, and what the positive consequences that you are hoping for look like before you make any decisions. But there's no point in rehashing the same decision over and over again. I really think that this is the biggest thing that you can take from it is say, okay, what are the lessons that I can learn from this, so I can, in theory, if I were to go through the same situation again, I would make a better choice this time, or at least a choice that I feel better about. And the final comment that I'll read is it's from this person. She says, oh my God, you poor love to be feeling this way. As you can tell, I find this way of talking to people a little bit condescending, and it does not appeal to me, but here we are. She says, it's so best to get it done sooner rather than later, as it can have serious implications on feeding, and a lot of pain for you now, and speech issues or with eating later on. Babies really don't feel it when they're tiny. There's basically no nerves there for them to feel it. It's honestly no worse for them than getting jabs done. My little one had his tongue tie released, and it definitely looked worse than it was because of the blood. Anecdotally, my husband, who was bottle fed, had to undergo general anesthetic when he was 5 to release his tongue tie, which is obviously much worse than a small baby snip. Make sure you stick to the exercises they prescribed, and please don't feel bad. You've done something necessary to help your baby thrive. And these types of comments, not only because of the statement at the beginning, but these types of comments really grind my gears. They're the ones that make me really angry. So you cannot, as an external person on the internet, know or be able to tell whether this was the right decision for this child or not. And the reassurance of, oh, no, of course you had to do it, is a terrible one and can be really, really harmful. And then the claim, babies really don't feel it when they're tiny. There's basically no nerves there for them to feel it. There are a lot of babies who are in quite a lot of pain as a result of this procedure. For a very, very, very long time, unfortunately, we believed that babies just don't feel pain because, I don't know, they're babies and they can't tell you that they feel pain. Even though clearly if you poke them with something sharp, they will cry. And if they scratch themselves, they will cry. Of course, they experience pain. But for a very long time, we treated it as if because they're so small, they won't experience, they just can't tell that something has happened. And it's so much worse to do. Honestly, if you do it as a 5-year-old, then you do it because it's absolutely necessary for you. It's medically necessary for you. Whereas with a baby, there is a potential that it might not be medically necessary for you. And so those are two completely different scenarios, and the comparison is really unfair and really terrible. And yeah, I just wish that people did not have this laissez-faire attitude in terms of how they interact with their babies and in terms of the medical decisions that they make for their babies. And the claim that, they won't remember anyway, so it'll be fine, is a terrible one as well, which does come up in this thread. So there are very many reasons and there are very many ways that you can just make good decisions for your kids. And that isn't to say that you might not still make mistakes, and mistakes might happen. And of course, as a parent, you're always motivated by the best of intentions. But intentions are not enough if you don't do your due diligence and you don't take your responsibility as a parent seriously enough to make good decisions for your kids. Also, don't randomly pat people on the back who you don't know and who you know nothing about when they make decisions that may be wrong. That's not a good attitude either. Don't trust the internet if they try to do that.